Welcome. My name is Jason Helgerson, and this is the latest in our series of New York DSRIP Whiteboards. Today's topic, an eye towards the future. Today I talk about what we see even beyond the goals of DSRIP, beyond the goals of trying to achieve a more cost-effective healthcare delivery system, to talk about what the healthcare sector can do in collaboration with other systems to really improve the health and well-being and even maybe the happiness of the communities in which we serve. So DSRIP, as I think most people who've been following it know, is really about healthcare system transformation. It's about injecting seed capital into the system to try to ensure that the healthcare delivery system that so many of our New Yorkers, in fact, are using each and every day is as efficient, as effective as possible. The goals of that initiative really do focus on healthcare outcomes. However, we know that DSRIP and the healthcare system is only one system that affects the millions of New Yorkers all across our state. And that what we need to do is better coordinate activities in each of the communities in our state, not only at the healthcare level, but at other systems that intersect with those same individuals and families. And we also, I think, need to begin to talk about how the healthcare sector can begin to address in its own ways, using its own assets and abilities, some other outcomes that society really cares about. Outcomes that take into account the fact that we have many challenges in our society, and while healthcare can't individually address these on its own, it can perform the role of an important change agent and can be part of a broader community-wide effort. Just to give you a flavor of a few metrics where this is going to matter. First and foremost, kindergarten readiness. We know that when kids enter school ready to learn, they're far more likely to graduate from high school, they're far more likely to go on to higher education, they're far more likely to be successful in life. What can the healthcare sector do? Well, we provide a lot of services to children. Most of the people on the Medicaid program are, in fact, children. And I think there's things we can do as a sector in the services we provide in collaboration with other systems to help increase the number of children ready to learn. Next up, community happiness. We know that happiness is directly correlated to health, and particularly to individuals' mental health. Happiness is impacted by lots of different aspects of society, lots of different systems. Can we begin community-wide conversations about benchmarking happiness and actually begin to think what strategies can be deployed to make our societies, make our communities happier, and hence, with that, healthier? Next up, quality of life. Many measures of quality of life, some of which are healthcare specific, but healthcare, we have to remember, is a sixth of our total economy. In many communities, it's the largest single employer. There are things that, though in that capacity, the healthcare sector can do to look at quality of life more broadly than just the traditional healthcare metrics. And then lastly, mortality. Obviously, a core function of the healthcare system is to extend life. But there are other things that lead to and control outcomes in mortality. We need to think across sectors. If we want to extend the lives of our community, improve the quality of life for individuals, we need to begin to have these cross-system conversations. So what do we mean by cross-system conversations and alignment? Well, as I say, healthcare is but one sector in our society. It's an important sector, and as I said, it's one of the largest. But that said, there are other elements of our society who are challenged with and grappling with many of the same social challenges that I mentioned earlier. How can we, as a sector, begin to work with social services, work with education, work with the criminal justice system, work with housing, and work with employment services to begin to see the holistic needs of the community, begin to address each other's metrics, working together? And what I encourage healthcare providers to do is to look across your communities, see who is engaging in these efforts, embrace those efforts, embrace the metrics they're trying to move. And if such efforts do not already exist in your community, demonstrate leadership. Be willing to create a table and invite people from these other systems to join you in a community-wide effort. Those community-wide efforts can be extremely powerful. They can help you achieve your district objectives, and more importantly, help improve the quality of life for the people who live in the community in which you serve. So thank you very much. Look forward to seeing you in the next whiteboard video.